Welcome to this week's PSYC2061 media release, where today we'll be talking about how emotionally validating preschoolers may increase their perseverance on challenging tasks. A recent 2024 study found that acknowledging children's feelings may significantly strengthen their ability to persist through challenging tasks. Conducted by Dr. Jiwon Jeon and Daeun Park in 2024, your feelings are reasonable. Emotional validation promotes persistence among preschoolers, presents emotional validation as a practical tool parents and educators can use to support early learning and resilience. Emotional validation involves understanding someone's feelings and perspective, even when you don't agree, helping to create trust, support, and problem solving. This is not to be mistaken for permissiveness, which involves low expectations and minimal use of discipline. Children raised with this parenting style have freedom in decisions but may be impulsive or lack self-regulation skills. Rather, emotional validation aims to support self-regulation and discipline to remain engaged even when challenged. Although previous experiments have observed similar effects in adults and others focused on the influence of behavioral parameters, such as role modeling, on persistence, none have explored the effects of emotional validation on children. This study expands on this prior knowledge by observing how emotional validation may influence perseverance on challenging tasks, specifically relating to preschool-aged children. The study explored how children respond when adults acknowledge their emotions during challenging motor tasks. The 4 to 6-year-olds conducted 2 tasks, and without their knowledge, these tasks had no solution. Following this, they were either validated, invalidated, or treated neutrally and asked to report how they felt. In a contained experiment where the researcher and child were one-on-one, it was found that children who received emotional validation from an adult demonstrated significantly higher levels of persistence on subsequent tasks compared to those who were invalidated or received no feedback. These children worked longer, were less likely to quit prematurely, and showed greater resilience. In contrast, children whose emotions were ignored or dismissed were more likely to disengage or avoid challenging activities. Notably, there was little to no difference between the children who were invalidated or treated neutrally. However, this study has limitations to be amended and explored in future research. For example, when conducting the experiment, the researcher counted how long the children persisted on an activity. As a secondary measure, most children were recorded, so a blind counter could provide test-retest reliability. However, some parents did not consent to the recording, so the blind counter could not provide a second opinion. Due to this, the experimenters excluded these children from the reliability calculation, decreasing the accuracy. However, it was mentioned before that the children did not know there was no solution to the challenging tasks. This is common in other studies, but may introduce other reasons for the results of this study. For example, verbal emotional validation may distract the children from noticing the lack of progress in the task, rather than actually increasing persistence to complete it. To further investigate this possibility, future research may look into using tasks that still measure perseverance, but differently, such as challenges with a defined ending and point of success, or that become increasingly difficult with time or completion. The authors theorize emotional validation may enhance persistence by helping children feel supported, thus reducing emotional stress and freeing up cognitive resources for problem solving. When a child hears phrases like, "It's okay to feel frustrated, this is hard," they experience a sense of security that allows them to cope more effectively with difficulty. Contrastingly, common, well-intentioned adult responses, such as "you're fine" or "don't be upset," may inadvertently signal to the child that their feelings are inappropriate or unwelcome. For parents, teachers, and caregivers, the takeaway is practical and accessible. Acknowledging a child's feelings may be one of the most effective and immediate ways to help them build resilience. Thank you for joining us for this week's PSYC2061 media release. We look forward to seeing you in the next one.